positions to the height she's able to manage us, to lead us to the right path. So, ma'am, happy that you are with us today for today's meeting. And over to you, ma'am.
Thank you, Vidhu, so much. And it is the love and affection of Kerala, IHA Kerala, and all of you. I have many friends in Kerala and I've worked with most of you. Thank you for inviting me, especially you and Dr. Ranjit, who had tried to approach me. And immediately I accepted because it's, you're all part of family for me. So this is a very important topic. I love, IHA Kerala always brings in new topics, new ideas, and Kerala is in the forefront for many programs. Hats off to you, all of you. IAP, along with, you're also coordinating with IAP branches, IAP Kerala and also the Trivandrum, which are working together. So my regards to all of you, Dr. Ranjit as the chair and Dr. Vidhu as secretary. I wish you all the best for future endeavors in bringing adolescent health forward. And during my next year, I'm sure I'll be having new ideas from all of you. Please give me some inputs and we'll work together at the national level too. Again, my regards to all of you, Dr. Shimi Paulus sir, Dr. Riaz, Krishna Mohan, and we have Hari Prasad and Andrew. Many of you are here. Now, without this is a very important topic, sports in adolescent, because we all when we talk about adolescent health, it's not just physical, mental, metabolic. Metabolic actually is coming up in the forefront now, and for all many reasons where sports is important. So even for mental wellness, we say you need to encourage the child into sports activity, even sexual activity. When we say there's high risk behavior, or to cope up with the other issues in sexuality, there also we promote that sports is very important. So as a relaxation, as a fitness, many I think benefits are there. Dr. Siddharth will tell us. So it's a very relevant topic for today's time, as already mentioned by Dr. Shimmi. Within between the role models, we have Shah Rukh's and Salman's here. And it is we have a lot of gyms sprouting up actually now all over. In every lane, we can see gyms coming in. So many doubts are there. The parents may have a lot of doubts. The teachers also may require guidance from us pediatricians. I think sports medicine is a very upcoming subject. So who should do what? Weight training, the stretches, the flexibility, and even the diet issues. They have a lot of steroids and so many things are involved. The drinks, some over-the-counter drinks are available. So they just look into these ads and then the children, they take it. So we require a lot of clarity on all these things. I'm sure Dr. Siddharth will take us through. To introduce Dr. Siddharth, he is a sports medicine specialist, consultant at Lee Regain Clinic, Aster MedCity, All India Football Federation Medical Committee member, consultant to Kerala Cricket Association and also the Football Association. And he's also General Secretary of Indian Society of Sports and Exercise Medicine. So this is his introduction. I'm personally very fascinated to hear you, Dr. Siddharth. I'm sure all the members and participants are looking forward to your talk. Over to you for enlightening us. What are the do's and don'ts about sports for adolescents? Thank you.
Thank you for the wonderful introduction. First of all, I would like to thank IAP because they always bring out sports medicine. They always invite me. I have to thank IAP for promoting sports and exercise. There are other fields which do it. Now sports medicine is growing quite big. There's a new advent of leagues which is starting. You have got the ISL. You have got cricket leagues. Now, recently in Kerala, two leagues have started: the Kerala Super League and the Kerala Cricket League. So a lot of teenagers now have got opportunities into sports, which is coming up because they want to catch them young. That's the aim of these leagues, actually, to catch them young, to train them young, and to develop sports in India. What has happened is that there's been an advent of recently I've been getting quite a lot of I see a lot of teenagers, more than normal adult patients. I actually see a lot of teenagers, and I've got a lot of these for the past 10 years I've been practicing sports medicine, and I've got teenagers who have now turned into Olympians. We have got Abdullah Abubakar, Sri Shankar, all of them have been there. So it's quite interesting to see, the different kinds, there are numerous failures, kids who are very talented, who are much talented, and you don't see them develop while there are and there are a lot of doubts. Parents ask me hundreds of doubts, including teachers. So I'll come to the presentation first. Just I hope I'm visible
Yes,
to everyone.
yes.
Yeah. So I'll be speaking about exercise and sports because see, basically, it's more about exercising that many people have doubt. Sports, everybody has got a universal understanding that sports is good. Now, but exercise is where the doubt always lies as to what is to be done, whether this I'm doing is right, and whether I can send my kid to the gym. If I'm going to the gym, what is to be done? So I'll just tell about my field. I am an MD sports medicine. I'm a little bit rare field. I was the fifth in India when I did my MD sports medicine. There are quite a good number of us now coming up. Now multiple medical colleges have started MD sports medicine. Um, so what is sports and exercise medicine? So basically, it's a branch of medicine which encompasses physical fitness or exercise. So what we deal is basically those who exercise, and our main job is prevention of injuries. We are actually bad for hospitals because we prevent injuries. We are hired by clubs, we are hired by teams, basically is to prevent injuries. In US, UK, our field is very well developed. We even go into super specialty where we go into biomechanics, we go into certain other areas where we are interested. But in India, we are just still growing. So there is still a lack of knowledge about sports medicine, but now it's picking up quite well. So what we do is basically, if anybody, is interested in exercise, how to go about it and how do we prevent injuries. Now, if injury occurs, how do we get back as quickly as possible? The thing is that ours is very multidisciplinary. We work with orthos, we work with gynecs, we work with multiple teams, with physios. We cannot work as an individual person actually in our field. Our main thing is we do not operate. We are not surgeons. We are not orthopedic. People have an idea that orthopedics are sports medicine. They are totally different fields. Orthopedicians, because people relate that sports injuries are mainly musculoskeletal, so they should be seen by only orthopedicians. But we deal with multiple other areas actually. We deal with nutrition, we deal with cardiology, we deal with physiotherapy, we deal with internal medicine, strength and conditioning, psychology, general medicine. So the key is what I'm trying to tell is that we deal with multiple factors over here. It's not only about, you understood, just injuries, what we deal with. We deal with a lot of things. Screening is one thing in other countries, especially in Italy, in Europe, even in Sri Lanka. It is compulsory for if you are getting into sport, you have to get a screening done. It's a compulsory rule which has been made as a law. In Italy, you have to do an echocardiogram and ECG as well as a complete screening by a sports medicine doctor, get the seal, and then only you can enter into the sport for that season. Similarly, for Sri Lanka and other US and all, it's more of ECG has to be done. So over there, it's more developed. We in India, it's still coming up. People are starting to get an idea as to what is to be done and what is not to be done and everything. So let me come into the main topic. Exercise in adolescence. So the first question is always how much exercise is needed for a child, adolescent, how much exercise is needed. Now the CDC itself has come out with a set of values which has properly said that for any kids aged 5 to 17, they need 60 minutes of moderate to vigorous exercise every day. So you either run, play, sport, 60 minutes minimum every day, preferably at least 5 days a week. That's what every day means in their lingo. Cardio should make up most of the 60 minutes. That's the main key. They have to run, they have to jump quite a lot. 3 days per week should be containing a lot of strength training. That is the key over here, where you do a lot of running, you do a lot of jumping. This increases bone strength. Now the problem is that most kids, we think that okay, we'll do just he's going for walking. Walking is a single cardio based exercise, but that alone won't be beneficial for a child. They need to be doing a lot of running, jumping activities. So, plyometric activities are the key for a healthy child actually. The more your bone develops, the more it becomes more stronger. So jumping activities we always advise. We tell them that's why hopscotch is one of the best easiest for children, which we tell them. You run around, play tag, you play hide and seek, but then do hopscotch. So when they do the jumping, this thing, that's one of the best exercises which I always tell, very, very easy to do. for small children to, to get into games and everything. Now, how do you measure your exercises? Now we know how much exercise is required. Now the word has always been, okay, there's moderate exercise and there's vigorous exercise. But how do we tell, okay, this much? So usually we tell, no, as in adult, doctors, we tell them, you do brisk walking. The problem is that nobody knows what actual brisk walking is. So how do we tell the intensity of exercise? One of the most easiest tests which I tell is talk test. So how you do is that you divide it into three areas. So light, you can talk and sing while you are walking. That is basically a very light exercise. So that has got very light exercise. But if you can talk, but you cannot sing, that is moderate in this. This is what brisk walking comes to actually. So if you're telling an adult, you've got a heart issue, you've got somebody, where the doctor has told you do brisk walking. This is the walking, what he means. This is the most simplest format, which I'm telling. So where you tell the person you walk as fast, but you should be able to talk, but you should not be breathless. That is the key. You should not be able to sing. In vigorous, you have to have difficulty in talking also. That is the exercise which we want for children also. The more vigorous type of exercise where they are, they can say certain words, they're breathing quite heavily. This helps in expanding the lung. This this allows a lot of growth in them. So there are these three types. So we want in moderate and vigorous intensity of exercises. Now, depending upon the medical condition, that changes always. This is just for a general outlook, which I'm telling. Now, if you want to go a little bit more scientifically, what we tell is heart rate zones. We come into heart rate zones. So this is for an adult, which I'm telling. Since in children, it's a little bit, it's totally different. But in adults, what we say is that there's something called heart rate zones. So we have got your max heart rate, which is 220 minus age. So for example, if you are 40 years old, your maximum heart rate should be 180. So your intensity will be based on the maximum percentage of maximum heart rate. So if you see the graph, you can see your light intensity will be less than 65% of your maximum heart rate, while moderate is 64 to 65 to 75%, while vigorous will be 75 to 90% almost. So it changes based on the age. You understood? It changes based on age. And this is for adults. You have to understand this is for adults. This is for us because I thought that many people don't know about this area. And this is how we actually advise, to burn fat. We want, say, for example, if we tell light intensity exercises, we want you to maintain less than 60% of your maximum heart rate for at least 1.5 hours. You have to go, or 1 hour of walking, 60 minutes of walking for 5 days. This is the protocol which we might tell. For a brisk walking, we will tell maybe do 45 minutes of moderate intensity of walking where you maintain your heart rate at this range. This is where all this gimmicky Apple phone, your all the different type of Samsung Health, your Apple watches and all your watches which all measure all the heart rates. That is where this works actually.
ऑर्गेनिक का प्लान किया था ऑक्सीजन
So
ओसी
anybody doubt? No. Okay. These are the different types of intensity. Now, the vigorous intensity is when you play quite a lot. You are playing a sport, that is always vigorous intensity. While moderate intensity is usually your brisk walking, where you are going walking in the morning quite very fast. That's moderate intensity. While light intensity is just plain walking. You are relaxing yourself, and that is plain walking. Now, each has its benefits. That's the beauty of it. It's not like light intensity doesn't work at all. Light intensity, it is all about the timing. The more longer you do, the more better it becomes. You'll be burning more fat. So some people who cannot, push themselves, we tell them do light intensity. So based on that is the heart rate zones which we divide. So this is the more scientific version which we tell, if a person who wants to burn fat, he wants to get thinner, how we go about, I always go with this heart rate. I tell them, okay, I want you to measure your heart rate in your Apple Watch, and you have to tell me how much your average this thing, make a diary and give it to me by the end of this week. So 1 week we'll know how much when he exercises, how much was the maintenance. So with that, I can tell whether he's been doing actual intensity of exercise, whether he's cheating, he's not cheating, all of that will always help me in correcting and, helping them exercise quite a bit. Now, in children, it's a little bit different. The thing is that in children, their heart rate totally varies completely and they are not yet an adult. So what needs to be looked over here is resting heart rate and how fast they recover. That is the key in children. So, for example, This is the usual heart rate which we see in 5 to 12 years, and in adolescents, it's around 60 to 100 to 120, depends. So what we see is that now they have exercised, and how quickly they get back into, they get recover from that. That is more interesting for us in children in exercise, and that tells us that whether they are more healthy and not. That is the way we do in children to tell heart zones, and that is a little bit more complicated. Usually what we do is when we treat athletes, when they are into athletes, this is where we work quite a bit with elite level athletes. For children, what we tell is that you do a combination of multiple exercises, a little bit of strength exercises, a combination of mix of exercises, and that's how we go about it for a general kid. But for if you want an elite, you want to find out exactly how to lose weight, an obese kid, how to lose weight, we go about this, how fast is recovering, whether that athlete is recovering. That is what we see in children. And we try to get back that quick. The more faster he recovers, the better he is, more healthier he is. That's what we see. Now, the most difficult thing, how to make a teenager exercise. This is always asked quite a lot. Parents come to me and they sit and they question, doctor is not at all exercising. He has multiple, he's very lazy. How do you, I want him to get out of the house. I want to make him play. I want to make him. No, the first thing which I always tell you have to understand is that each child is different. Teenagers, children, all are different. The problem is that we try to club them into one, and we think that playing, is exercise structure for them. So what I do is that first I watch and talk to the child. That's the most important thing. What does he like? Whether he is, some children don't like groups. They are more of an introvert character. They don't like playing in groups. I don't like multiple sports. I like to play as an individual mainly. Some are very social. They like to play. They are always out. This thing. So based on that, I would choose the sport. Now, if a kid who doesn't like groups, what I would do is that I would start him on telling him about running. A little bit of gym-based exercise where he's not in a group setup. He's in an individual setup. Now, for a social kid, I will introduce him to sports. So in sports, group sports would be better for him than an individual sport. So that is where I'll introduce him to different things, and that is how I gauge what interests him. There'll be certain things definitely which will interest him more. Certain kids will always have an ideal structure which will definitely help them, and we focus on that area. That's how we go about it. That's what the key is: identify and choosing the exercise. You have to identify. So, for example, a child who doesn't like to go out, he is a little bit shy. He doesn't talk much. He cannot make friends quite easily, but he's quite okay, and you want to make him exercise something. So start with him with a little bit of cycling, where he's cycling outside. A little bit of outside work he's getting. He's doing some form of cycling. It's an individual thing. So he's doing something alone. He doesn't have to interact with anybody. Now, if he finds that too hard, make him do indoor cycling where he's in a controlled environment. So there are multiple ways where we can make a child exercise. It's just that we have to find out what is ideal for the child. The most difficult thing is to talk with the child. The child will always express what he likes, what she likes. It's just making a connection with them and then talking with them. And teenagers are one of the most difficult people to make connections with, because we think that they are almost an adult, or they are, hormonal. They don't listen to you. They are rebellious. But there are small clues which will definitely work on them. You can talk to them. Tell them to create a diary. Tell them what works, which you didn't like. You don't like the sport. They will actually tell you which sport they don't enjoy, which they like, they enjoy. They'll say some kids directly tell me, I love the gym. I prefer to go to the gym, but my mom is not allowing me, saying that it is bad for your health. So then I have to correct them and tell them what exactly has to be done in the gym and move on. So you have to understand also what might be boring for you may be fun for a child. That is something which I always tell, because we assume a lot of things, which might be boring for us, might be boring for them also. That is not the case. One of the best examples which I find is skipping. Children love skipping, but we think that skipping is a boring exercise. It's not a very interesting exercise. It's repetitive, but children loved it. So I introduce exercise from skipping itself. I tell them, do you like skipping? Have you ever done skipping? Then they say that, no, I'm not done. Then I say that, okay, get me what you're going to do is you're going to go to Decathlon. You're going to get me a skipping rope. You're going to you're going to take a video of you doing 20 skipping for me, and then you have to send it to me. So what happens is that now the kid has got an aim. He is going to do 20 skipping. The first time when somebody does, if those who have done skipping, they will know that first time doing is one of the most toughest thing. You never get it right. So he gets irritated, he gets frustrated, but I'm giving him a name and he has to record and show me. So I tell him, you have got 1 week to at least show me 20. However you do it is okay for me, but show me 20. Now what he has done is done 20. Once he has achieved that, now we give them more different type of exercise. You tell him that, okay, that's good, you have done 20. Now what else exercise? We'll do a little bit of squats, we'll do this thing. So I add and mix a little bit of exercises. Now it's becoming interesting for him. He's doing something, he's getting to move, he's trying out different exercises. You have to make it fun for them. The most important thing which I always tell is that children copy parents. If parents exercise, children will exercise. If parents don't exercise, children won't exercise. So I always tell parents that is, do you exercise? That's my first question. Is that the parent will look at me very strangely always. Doctor, I'm not the patient. He's the patient. Why are you looking at me? So I say that why you don't exercise? He said I've got enough work already. I'm office this thing. I say that spend half an hour, just half an hour of exercise. Both of you do together for me. I want you to do these exercises together. So what happens is that when a parent is always doing, just one parent, or you can do it as a family together. When it's a group activity, it's more fun for the child also. There's more family bonding also. There's more of a social growth also for the child. And it helps, it brings fun into exercise also. Usually I tell, if they are going to the gym, if the father goes to the gym, I tell them, take the child with you, teach him technique. You are doing quite well bench press. You don't need to make him do a bench press, but you just make him lift a certain small weight, or show him how it is to be done. Technique matters. So what happens is that now he is bonding with the father, and he is or she is bonding with the father, and she is learning a new trick, new exercise. And this brings a lot of exercise. You bring discipline. When you are disciplined, then naturally the child will also be disciplined. So I always tell the parents that if you want to make him exercise, you have to exercise for me also. So then they look at me very funny when I tell them, okay, you have to do squats. Show me how you are doing squat. And the child enjoys it more, when I make the mother or father do a squat and show me and all. So that's how I interact with the child, and the child becomes much more closer now. Now it's more interacting. You're punching the parent now. So it becomes more fun for them, and they also enjoy it, and they start interacting more. Now they understand, okay, this exercise, this is this thing. So if a parent goes and plays, I tell them, why don't you play a badminton game with the child? Teach him. There's nothing wrong. Tap, little bit tapping. You do a little bit tapping. Tap, do movements. So what happens is the child will definitely copy the parent, and that's the best way to make a child exercise. When a parent does it, naturally the child will naturally do it most of the time. Now, this is the biggest myth, which I have always in my slides whenever I present in different forums. This is one of the most common slide, which I put, weight training, does it cause loss of height? This is an absolute myth. It does not cause, most parents ask me, height will reduce, they will become short. This thing, I tell them, no, there are enough number of studies, huge number of studies are there, which does not. The key is always, it needs to be supervised. Any child, I tell, you can start going to the gym from around some 6 or 7 years old. You can shift to the gym, but the key is that it needs to be supervised. In early age group, you don't need weights. You need a lot of body based exercises can be done. So for example, you can do push-ups, you can do squats, you can do lunges, you can do plank, side plank. There are enough number of body based exercises which you can teach, how to do a push-up, how to do a proper squat. So all of this, what happens is that the child learns those techniques. From there, you can develop into weights. You can slowly start introduction of small weights, how to do a dumbbell press, how to do an Arnold press, how to do a bench press, how to do a weighted squat. All of this small, it doesn't need to be very heavy weights. It just needs to be small weights. This will definitely help. I always tell to all my patients that strength training and exercise are two different things. Whenever I ask a parent, okay, does he exercise? They always say, yeah, he runs around. No, that is a form of exercise. He plays, yes, he plays, but does he do any strengthening exercise? That is the key where it matters. You need to do at least 3 days in a week strength training. Now, this is for adults also, which I'm trying to tell. It's also for the adults also, those who go for walking. If you tell me that your exercise is only walking, shame on you. You need to be doing some form of strengthening also. So some form of strengthening, especially if you can take a small amount of weight, resistance training, you don't need weights. You can have bands. There are resistant bands. There are different type of resistance training now, which definitely helps. For diabetics, definitely resistance training. If you have type 1 diabetics, once their sugars are better controlled, I always tell add resistance training in their, training, in their exercise. Because what happens is that brings down the blood sugar, and there are enough studies to prove that also. So resistance training is a wonderful exercise to reduce blood sugar for type 2 diabetes as well as for type 1 diabetics also. The key focus is always on technique. That's what I said, how to do a squat. The problem is that when technique and it is not supervised, that is when injuries occurs. Those injuries are usually growth injuries which occurs, and that is where the problem always lies. Now, the problem is that people associate with strength training with heavy weights. You don't need heavy weight. With 1 kilo of weight, I can make it very tough for anybody. It's just that you need to know what exercise to be given. So if you find that doing push-up, I can do 20 push-ups very easily. I can make you more tougher. I'll tell you, just tighten your glutes and tighten your core, and then do me push-up for me. You'll find it suddenly it's very difficult. That's how I change small things to make it more interesting. So that is where the exercises change actually, and you don't need heavy weights. You just need small weights. Always start slow and progress upper. That is how I tell for any child, any adult also. So let's come to common injuries. I thought that since you deal with a lot of teenagers, and there are always some injuries which they will come with. I thought the most common, sports medicine injuries, which I see in OP always, growing pains. This is one of the most common thing which I get always. Moms come with me and they tell me that at night he's getting severe pain, especially cramping is occurring. This has nothing to do with growing. That's the first thing. It is in 1800s they thought that this is in children, they are growing there, so their bones are lengthening, so that's why it is because of that. It has nothing to do with growing. The main it is because of the lack of muscle strength, and they are overloaded. That is why this pain occurs. They must have done some new activity. They must extracurricular activity has been increased, so that is where the pain starts rising. So ask for any change in physical activity, new sport or dance. Many people forget about dance as an exercise. Dance is a wonderful exercise. If you are getting them into classical dance, it's even more harder than regular, Western type of dance. Classical dance is one of the most hardest, which I consider. And it's definitely you. I had a kid who was a national swimmer when she was going into burnout. And so when I asked her, what do you do on a daily activity? She gets up at 5 in the morning, goes for training 2 hours till 7:30, gets up, eats breakfast, goes to school. School ends by 3:30, comes back, goes changes, gets into the gym for around half an hour, and then after that she does along with it one more cycle of swimming for 1 hour. After that she has a break for half an hour, eats something, and then goes for dancing for 1 hour, and then she goes back home. So I don't know any human being is going to get exhausted from that. So you have to find out whether they have added any new sport, whether they're doing something new, physical activity has been done. That is very important to be asked. The key always is focus on stretching. Flexibility is very important here. Most of the children do not stretch. They always are ready to play, but never stretching. I'll be coming into that a little bit also. If pain is very severe, always a paracetamol or ibuprofen definitely helps. I always ask for checking for vitamin D because nowadays vitamin D deficiency is very common. I make sure that I check for all my patients, and I think at least 80% of them are deficient. Either the lab is giving me results like that, or I'm finding it out. But then my sports nutritionist did a study also in teenagers. She's doing a PhD, so in that she did adolescent to from 16 to 25 athletes, elite athletes, and she found out around 80% were deficient. So vitamin D deficiency is very common, and that can also cause such pains. So make sure you check always your vitamin D. Apophysitis, this is one of the other common injury which is usually seen. Most common, you have heard of Osgood-Schlatter's Sivers disease, anterior superior iliac spine injury. So Osgood-Schlatter's always occurs on the tibial spine. That's because of overloading. Most who get these injuries are either athletes or kids who run and exercise hugely. They are very active, and these kids are the one who get such type of injuries. Sivers disease is usually on the calcaneum growth plate. That is where it occurs. While on the hip area, you get on the iliac crest, the anterior superior iliac spine, the anterior inferior iliac spine, the pubic symphysis, the ischial tuberosity. Now, why it occurs is basically the principle is that on in children, their bone is not developed fully. So what happens is the muscle gets overloaded and it becomes very tight, and it starts pulling on the growth plate, which causes separation, and that causes inflammation, and that is what is the main causes of pain. So the most common which you see will be the Osgood-Schlatter's, which is on the knee. You'll have two bumps always, and by the age of 17, 18, this totally heals off because the bone will fuse. Once that occurs, then the injury changes. It becomes a muscle tear. So then the injury completely changes. But till then, the injury will be like this. So it's occurring mainly due to overload. So the treatment for this, usually what I do is depending on pain. So how severe their pain is, relative rest from that activity. So if they play quite a lot of sport, I tell them you have to reduce your sport. You should not be doing any exercises. I mean, any sport for me. That sport. So if he plays football, he plays cricket, he plays multiple sport, I tell him remove from all the sport. What I'll be doing is that I'll give him a combination of stretching exercises. Usually, I tell him give me 2 weeks because more than that, children will not listen to you. It's very difficult to make them, without them playing. So I tell them, give me 2 weeks. What I want you to do is that every day I want you to do twice daily these stretching and strengthening exercises. So if it's the knee, usually what I do is calf stretches, one joint above, one joint below. That's how I always work with. So if it's the knee, I always make sure ankle mobility, so calf stretches, TA exercises, tibialis anterior exercises, the hip is strengthened, the quadriceps strengthened while stretching all of those muscles also, especially the quadriceps and the rectus femoris, main muscle, which is stretched, so that the load on the patellar tendon is reduced, so that the Osgood-Schlatter's will reduce. That is the main combo. Complete rest is never the answer. The problem is that in sports medicine, if I will never say rest, I will never tell rest. What I will tell is relative rest. Basically, what I will do is that I will give that rest to that area. That is all. Because I hate muscle loss. I deal with athletes, so we don't have time. We have to get you back as quickly as possible and much better. So what we do is that we give rest to that area while we strengthen the surrounding areas in different ways, which does not cause pain or does not cause inflammation. And that is how we work with children, with adults, with whoever you tell me. You come with a normal tennis elbow, also a normal person comes with tennis elbow, I'll be working like this only. I will never give complete rest. I'll start you with grip strengthening, forearm exercise. I'll tell you all of this scapular, and I'll tell you, okay, what I want you to do is wear a wristband, this armband. While you're working, you have to wear this and all. So this is how I work always. In certain cases where the pain is quite severe, I always give physiotherapy is always definitely beneficial. Now coming to shin splints is also very common. This is one of the most commonest injury which I see in children, especially teenagers, 16, 17, where it is mainly due to overload and poor strength. What happens is that most of the kids who come into this are basically who run quite a lot. They are runners. They will be running continuously without any break. And this is where they get injured. They get severe shin pain, and it will spread up where they cannot run anymore, where they have to rest. They say that I cannot run anymore. I've got severe pain. So that is when the parent gets worried and they come to ortho doctors or they come to me. And usually we tell them, yeah, this is shin splints, and usual treatment everybody does is rest. I'm a little bit different. As I told you, I don't like relative rest. One of the first things which I always ask for shin splints is shoes. Most of the time, we adjust and we don't think about the shoes. But shoe has a mileage. It does not work more than 500 to 800 kilometers. You have to change. So 6 months average, which I tell, if you play quite a lot or you run quite a lot, 6 months you have to change your shoes because you have worn out your midsole. Insole and midsole gets worn out. Outsole will be intact, but you don't notice it. So what happens is that the pressure becomes much more higher. Your ground reaction force becomes much more higher, and injury chances become higher. So I always tell, if you are a marathon runner, 6 months, if you keep on running, you have to 6 months, you have to keep changing your shoes. So I always ask about the shoe. How old is your shoe? When has been changed? Whether it's a new shoe. Certain people have, because it's a new shoe, they're not used to it and they run immediately 10 kilometers with that. So that causes pain also. So always I ask about the shoe. What I do is I offload them from activity like running. So I tell them that, see, you should not be running anymore because that can cause worsening of your injury. So you have to be a little bit careful. What I do is that I make them strengthen. So that is where I work usually. So especially tibialis anterior is one group of muscle which I like to work with, and I like soleus stretches. So many people don't know that when they stretch their calf, they always stretch the gastrocnemius more than the soleus. But the soleus is the thicker muscle, and it becomes tightened very hard. So I stretch the soleus muscle quite a lot, and I strengthen the tibialis anterior, usually resistance band, as you can see in the picture. With that, I make them do a lot of exercise, make it fun for them, and that's how we get them back into normal. And then slowly we start them into small form of jogging and strengthening, and it goes parallelly. Now, if the pain is quite severe, I always tell them you have to do 1 week of physiotherapy. And what we do in that is pain management. Physiotherapy is basically pain management with a little bit of strengthening. I work with strengthening at that, and the physio should be strengthening them also a little bit. Now, the most important thing in shin splints is that you have to rule out a stress fracture because that is sometimes missed out. And what happens is that we assume that shin splint, okay, he won't tell properly. So what we do is that we just palpate, take an X-ray, and we might have a suspicion. Better is to, if you have a suspicion, take a CT and confirm it. But usually you can see it in an X-ray if there's a stress fracture. In those cases, the treatment totally changes. He needs completely rest, where he has to be offloaded completely. You can give him basic exercises such as this, like lifting up SLRs, those type of exercises. But loading exercise, we more usually put them on a boot so that the fracture heals. Now, coming to acute injuries. Now, this is for strains and sprains, your ligament and tendons and muscles and injuries. If anything acute, you have fallen. We would have heard of the word rest, ice, compression, elevation. Then it became price, prevention, rest, and ice and elevation. What I follow is something called police. So police is basically protect optimal loading. So where we load right amount. That's what I told you, I don't like complete rest. You've understood from all these talks. I make sure that they do some form of movement. So there'll be optimal loading. It should be optimal, should not be overloading. That is the most key about it. Then ice, compression, and elevation, those are usually common. So this is what I do for acute injuries usually. So I put two slides because too much information is also not good. So I thought I'll put two slides. How do we prevent injuries? Because that is what my field is all about, preventing injuries in children. So if a mother always comes and asks me, Doc, I don't want them to be injured. So what do I do? He's a promising cricketer. He's a promising shuttle player, promising footballer. What do I make them do prevent injuries? So first thing which I tell them that you have to do strength training, no question asked, and it needs to be supervised. You cannot tell them go to the gym and do these all exercises. No, it needs to be supervised one-on-one, preferably, where if the parent can be involved, it would be better. And child should need to do strength training. That is what is going to prevent you from major any type of injury. If you don't do strength training, you are prone for injuries, guaranteed. This is the most important thing. Focus on a proper warm-up and stretch down after your exercise. This is in children, we try to get them disciplined a little bit because once they get into competitions and they get into this thing, they will usually follow because whatever the coaches say, they follow. But those who simply play around also, I try to tell them, get a little bit of warm-up. Before you're going to play a football, roughly you're going to play amateur, some turf you're going to play. So what I tell them is they do proper warm-up. Now I don't have time. So how do I do a proper warm-up? What I do is that I tell them do 50 jumping jacks for me or 20 jumping jacks. By the time they do 20 jumping jacks, they are warm already. So that's the most easiest way to get them to do some form of warm-up. What it does is that it gets the muscle ready for activity, some form of activity. And then after your exercise, make sure that they do some form of stretching. There are different type of stretchings, like in the picture, you can see quadricep stretching. That's one of the most common stretching which you can see. So there are different types. YouTube is now a lot of exercise, which stretching exercises which are there. You can choose that. We can choose around some 3 or 4 stretches, and that's more than enough. At least hold it for at least 15 seconds, and that is what helps prevent a lot of injuries. So focus on a proper warm up and a stretch down after exercise. Now, I tell play multiple sports. A child is come. They what they tell me is that this doctor, I want him to. He's a very good football player. I am focusing. He in between lunch period he goes and plays cricket. And then I tell him no, don't do that. Play football only. You have to play only. Focus on football. So for those I tell you should be playing multiple sports. Now why? Because the movements vary, the muscle usage varies. So a football player has got a lot of acceleration, deceleration movement. While you are going to kick, you are going to use your lower body quite a lot. Now a basketball, now he plays basketball. In the picture you see basketball. So the kid is playing basketball. Now the movement is totally different. The shoulder is usage, the how he jumps changes, how he kicks changes. If you take any top athlete, you take Virat Kohli, you take Dhoni, you take AB de Villiers, you take any of the top Olympic athletes, they all play multiple sports. They would have played multiple sports. Dhoni was a very good footballer, he was a goalkeeper. Virat Kohli used to play football also. AB de Villiers was a very good swimmer, hockey player. Yeah, he used to play multiple sports. So, swim a lot of sports. So, kids who play multiple sports will have a reduced chance for injury. So, multiple studies have shown that those who specialize in single sport alone have higher frequency of injury. And there's a beautiful study done by Wisconsin University where they found out that almost 2 times the injury chances are higher if you play only a single sport. Because what happens is that by playing a single sport, that muscle gets overloaded quite a lot. So the chances for injury is higher. That is the explanation for it. But for if you play multiple sports, your different muscles get exercised, get loaded, so you don't get injury. Your injury chances reduces quite a bit. The most important thing is look at the load. I always tell is that talk to the child, find out what and all they are doing. Make sure that what extracurricular activities, if they are doing singing, they are doing dancing, they are doing exercise, they are playing sports, they are going to the gym. Children will burn out. They are going to get a lot of injuries. I've had wonderful athletes who have burned out. I've got one girl who's an excellent swimmer. National level she had gone up to, but she was doing multiple things. Her parents were trying to push her into multiple things, and what happened is that at the end she got a major injury, and after that she was not the same. So this is the problem with multiple activities. So you have to make sure that the child is not overloaded, and you have to talk to the child and make sure that the parents also understand that pick and choose what you want them to do. Do not make them do everything at once, because we think that the child will be able to do, but it's going to be very difficult because they have to study also in this. In between all of this, they are going to study also. So just imagine I tell you, you come from clinic from morning till evening, and then you have to exercise, and then now you have to sit and study and do, it's not going to be easy at all. It is difficult for a child. You are going to get burned out after some time. So coming to the end, to summarize, what I wanted to say, teenagers are just children in a bigger body. That's what I always say. They are just. I have a chocolate always, a chocolate drawer under in my drawer always, and when teenagers come, I give them the chocolate, and they, first time they will always be hesitant. They'll be thinking that I'm a big boy, I'm a big girl. Why am I going to take chocolate? But then after that, they take, they feel very happy. Okay, I've got a chocolate. So it's always, and which doctor will give chocolate? I'm a sports medicine doctor. So I'm, unless he's not a diabetic or any other issue, then I always give them. That's how I, give a little bit of connection, bribery. So that's how I work with teenagers also. And the 60 minutes of vigorous exercise every day, that is the key. At least 5 days, 60 minutes of exercise is always important. The more exercise you do, the better it is always. Proper regimen of stretching and strengthening has to be done. So you have to focus on strengthening, you have to focus on stretching. If you don't do, you are going to get injured. That is very key. I always tell incorporate parents to work out with children. That is one of the takeaways which I always tell. When you try to incorporate parents, that time you understand, the difficulty. The parents will understand also. Okay, this is why the child is not liking it, or this is why the child is not enjoying it. Make it more fun. This is what we can do. So that is also one of the best motivators, and child also enjoys seeing the parents struggle also, when they do the exercise. Okay, I'm doing this, you are not able to do. So it's competitive also. So it's fun for the child, and it's one of the best motivators, which I always say. So thank you for listening. I try to make it as short and brief as possible because this topic is a huge topic which you've asked me. Exercise in teenagers. It's a textbook. There's one whole textbook for it also. So what I've done is that tried to take the most important part. The most important takeaways, because too much knowledge also will get confusing and it'll get because in your practice you see wide variety of area. But this is something interesting which I thought I'll try to put in, which you can add in your practice also. So thank you for listening. If you've got any questions, please do ask anything
Thank
about
you.
nutrition. I didn't mention much about nutrition because it was about exercise. I can answer all of those questions also.
Thank you, Dr. Siddharth. It was very practical and very informative. All the real practical things what the parents or the get this doubt, the children, the advice what they want from us. I think you have equipped all of us, and we require more such sessions for our teachers and parents, and that has to be told by the pediatrician. Most of the time, they really approach us. What should we give? What to do? When to send to the gym? All these are answered. I think there are a few questions. Dr. Deepa has put in a question. How fast should the heart rate recover after exercise in a healthy teen? Dr. Siddharth?
Yeah, so how fast means it depends. See, that is the thing. It changes. There is no specific timing which has been given right now. We also, because the problem is that studies are still coming into that area. In recovery in children, what we see is that so if he's done a 30-minute of exercise, now what we see is that it should at least be within 45 seconds or 1 minute, he should come back to normal. If he doesn't come back to normal, that means he's not healthy at all. That means he is not a person who exercises at all. This is for adults also. So, for example, you have climbed stairs in the hospital. You are climbing 4 floors of stairs, and now you are gasping. How quickly you can get back into normal breath? That is the key. That tells me how healthy you are. That's one of the most simplest way of telling how healthy you are. If you are not gasping, you are able to talk quite comfortably. That means you have got a very good lung capacity. You have got a strong. So same concept is for our children. Unfortunately, there is not much studies in that area. It's coming up quite a lot. But this is how we tell that resting heart rate. That's why I said that the most easiest way to do is that you just tell them vigorous exercise, because those things we come into elite level athletes. In regular children, we don't do those things where we check their resting heart rate and then we tell them to exercise and then come back and then again check their heart rate and then again check after like every 10 seconds. We see that how fast it comes back. So usually what we do is that we have a watch, a Garmin watch or something, and where we measure the heart rate and see how fast it recovers. This is basically sports science, which I'm telling you. This is the field of sports science and exercise physiology which comes into it. So those things and all, it is not yet we do it only mainly for elite athletes. For regular kids, it's not required actually. Regular kids, what we tell is that easiest thing is that what we combination of different exercises. That's what we make sure they do.
Yeah, thank you, Deepa, for that question. I hope that's answered. Yeah. There's one more question, Dr. Siddharth, by our treasurer, Dr. Sneha. How to differentiate between real sports workout pain and a functional student who does not want to play?
Yeah, that is the most difficult thing because first thing, you have to get the kid to talk. You have to spend time. Unfortunately, in those cases, you have to spend time with the child where you have to talk and find out what causes the pain. Usually, I mean, for me, I can easily identify whether a person is having actually a sporty pain or a functional pain very easily, because when I ask him, okay, you tell me what time do you, I mean, when do you get your pain? Do you get it immediately after playing, or do you get it after 10 minutes after playing, or do you get it this thing? So they'll say immediately after playing, or during playing itself, I get the pain, this thing. So then I ask them, okay, during playing, what activity do you get? Now you will suddenly see that he's now not very confident. He starts getting, or she starts getting questioned a lot. She starts thinking, I don't know this thing. That time itself, I know, okay. Because if you have a sport injury, the kid will immediately tell this activity, this time, this injury I got. They will always be very sure. Take your injury also. If you have got a back pain, or you have got something, when you do something, you have got a pain, you will immediately remember what was the cause of the pain, when you did that activity, what relieves the activity, you will immediately be able to tell. It's same for a child also. So you can easily, but only thing, you have to talk to the child and you have to find out what. That's how I differentiate between a functional pain and this thing. And so what I do for functional is basically I alternate the exercise. I tell them, okay, let's change the exercise. Let's do something different for you. So what I find out what interests them, and then that's how I go into exercise. So each person is different, right?
Yeah, I think you told that right. You have to work with their mind first and, see whether they're really interested and not forced upon. And, yeah, that will help. So any more questions from the floor?
Ma'am, I have one more question.
Yeah, Deepa.
Actually, Dr. Siddharth, it was a very excellent session as usual. And I just want to ask, what's your opinion on teenagers taking protein supplements? Or when they're athletes, do they need to take extra protein supplements?
Yeah. So I ask whenever parents ask me about protein supplement, I tell them two things. I ask them two things. First thing I ask them, what's the diet in the house? Whether you're getting enough amount of nutrition in your diet. So do you get everyday non-veg? You eat how many eggs you eat? I go in detail about your nutrition. I ask them, okay, morning when you get up, what do you eat? Afternoon, what do you eat? Evening snacks, anything, what do you eat? So I make sure what amount of protein what they consume I always assess. Then the second thing I ask is how much you train. So because that is also equally important. So if a person is only exercising for half an hour, you don't need protein powder. There's no use of protein powder if his diet is problem. Now if he's a athlete, he's in a hostel, he's in a sports hostel and he's not getting the amount of food and he's training quite heavily. In those cases, you can give safely one scoop of protein until their blood should be all cleared. That is the most important thing. I always get a screening done, always a renal screening, and make sure that everything is normal. And then I always definitely advise protein powder. In those cases, there's no harm at all. Protein powder is not harmful unless it is required. The requirement varies. It depends upon how much food they are getting and how much training they are doing. Simply going to the gym, you don't need protein powder. I always tell you, you eat two legs of chicken every day and have three egg whites if you want. That will give you enough protein for the day.
Thank you. Over to, I think, if there are no questions, I would like to hand over to Dr. Ashok Vidhu Ashok. Yeah, thank you for the opportunity. Wonderful talk. And there's a need of the day, where sports has become part of our lives and more children, young children are getting interested and parents themselves want to push them, but there should be a balance. Scientifically, we have to really understand what type of sport or what type of exercise for age appropriate, and basically it should be fun. I don't think it should be a pressure or force. They should, we should make it a fun and part of daily lives, and it's a family thing. So I think with these few words, I really thank IAP, AHA, both of them doing this program together. Especially thanks to Dr. Vidhu and Dr. Ranjit who have invited me, and I really thank both Trivandrum and Kerala IAP for this session. Thank you. Siddharth, you were just wonderful. I think more and more people will be stimulated to join this sports medicine. It's a wonderful talk. Very few are there, and rightly tapped you, Dr. Vidhu and Ranjit have rightly called you, and I think more of us AHA members will be very interested. Thank you.
Thank you for having me.
Over to
Thank
you,
you,
Dr.
ma'am,
Vidhu.
for chairing the session. Now for the comments, Dr. Anil Sood sir is there. Sir, a few words on it. Sir, there, Dr. Anil Sood.
It is a
Yes, sir.
excellent talk, I must say. But in fact, the NCDP chapter, we prepared a manual for conducting physical activities in school children. So that part was written by me, and I had emphasized that the adolescent should be encouraged to do all these exercises like squats, plunges and planks and push-ups. And I have also in the operation manual given all the don'ts so that children are made to understand how these exercises are to be done. So during SSS workshops which are being conducted by IAP, for that I have prepared that manual. I sent it to the IAP, and these SSS workshops are being carried out all over India, and they are getting good response. So
Yes,
there is definitely a role of prevention of injuries. For that, I emphasize that how these exercises should be done and what are the precautions to be taken during conducting those activities. And another thing I wanted to tell you that in the Padicon at Kochi this year only, I gave a talk on save evenings for play, not tuitions. So that is also an important message. If you send your children to play during the evenings, your children will get better scores and they will perform better academically. It's a myth that if you go out and play, the children will miss something. They will not be able to overshine because it's a competitive world, but parents are too much ignorant about it. They think that they are wasting their time in exercise. So
thank
that's
you,
what I
sir.
wanted to say.
Yeah, I think NCT chapter is doing a great job. I can see our Telangana Dr. Sri Sailam is a fitness freak and he keep on posting some messages and the nature, very close to nature and the tulip, cycling, many things, and he really motivates all of us. I can thank you for joining Dr. Nirbala and all others. Yeah, thank you. With your permission, I would like to leave Dr. Shvidu to join the EB meeting of AHA.
Yes.
Please carry on and thank you one and all. Yeah. Thank you.
Thank you. Dr. Sri Shailam, would you like to speak something?
Yeah. Please take their inputs.
Yeah, very sorry I joined just before the closing one. It was a favorite topic for me also because
But you should have been on a cycle.
sorry. Very unfortunately I missed it because sports medicine, I think at those days, 20 years back, it was not that it was not that popular then. So just if there is a recording, I'll just look into that because I just missed that because today it was OP was very busy. I tried many times to join, but it's heavy rains here. Lot of
Yeah, we'll be sharing it. We'll be sharing it. Sure.
yeah. Thank you very much. So anything I think regarding fitness, I think the thing should start from the parents only because whenever there is a child at home, they learn all things from us. So first we should start. So once we do it, only then they will do it. So we should not look like something like a teacher at home or a boss sitting on the sofa and ordering the children. So it should look as though we are part of it, and we should take the children whenever we go for a walk, be it for a cycle ride or any physical activity. We should take that, I think. So when a child comes to our home, I think the whole atmosphere at home should change. So we should stop watching TVs and cell phones. We should give more time with the child, and outdoor activities should be encouraged. Only then the success will be there. Otherwise, I think it's very tough. And to nurture a child, I think they rightly say that you might require a village to nurture a child. So true, because that means so many people are needed to nurture a child. So regarding physical activities, definitely the parents have a greater role.
Thank you, sir. Then I think by now, thank you, Dr. Siddharth, for the wonderful talk. Actually, all the points what he has put in, we'll be able to help our adolescents. The main thing, we think that they should exercise for only some time, but he has rightly put it that it's about 60 minutes for at least 3 times a week, and the way they should exercise and how we should take care of them and how nutrition is very important. Even for lifestyle diseases and all the talks we say, everything starts at home. So actually, rightly, as Dr. Sri Shailam also said, the parents, like once it starts with them, actually, whatever, whether whether it be a physical activity, whether it be nutrition, whether it be character of the child, everything, it starts at home. So we'll be able to help out our teens better, and we'll be able to arrange more such useful talks for ourselves and for our teens. Thank you. I think we'll call it a day. Thanks, everyone. Good night.
Right.